Right now, Obamacare under fire. Kathleen Sebelius on the hot seat today, forced to answer tough questions about healthcare.gov's rocky rollout. The question is, does the buck stop with her or with the commander-in-chief? And tonight, Congressman Leonard Lance, Republican from New Jersey, joins us live for our nation's capital to sound off. And later, get this, a Nevada lawmaker is stirring national outrage for saying he'd vote for slavery if that's what the constituents of Reno want. What was he thinking? Well, our power panel will weigh in. Good evening, everybody, and welcome to RFL. I'm Richard French, and thanks so much for joining us this Wednesday evening, October 30th. You know, a lot of lawmakers have been waiting to grill Health and Human Services Secretary Kathleen Sebelius about that rocky rollout of Obamacare, and today they got their chance. Now we're bringing Dominic Carter, who got the latest. And Dominic, it was not a pleasant morning for about 2.5 hours from Ms. Sebelius.
Not at all. Sebelius was under fire today, Richard, testifying before a House committee. She started off with an apology, but Richard, that wasn't enough for Republicans and even some Democrats who are demanding more answers. In Boston today, President Obama said again that he's not happy about the problems at healthcare.gov.
I take full responsibility for making sure it gets fixed ASAP.
And earlier today, his Health and Human Services Secretary, Kathleen Sebelius, fell on her sword.
Hold me accountable for the debacle.
Okay.
I'm responsible.
Since healthcare.gov launched, it's been plagued by major technical problems. Even as Sebelius was testifying, the website was showing this error message.
We're working day and night, and we'll continue until it's fixed.
Right out the gate, Sebelius apologized for what she said has been a miserably frustrating experience. But Republican lawmakers, many of whom have been chomping at the bit to grill the HHS secretary, wanted more.
While I think it's great that you're a team player and you're taking responsibility, it is the president's ultimate responsibility, correct?
You clearly, whatever. Yes, he is the president. He is responsible.
Lawmakers also zeroed in on this oft-repeated mantra from President Obama.
If you like your plan,
You can keep your plan. Turns out that's not true. 15 million Americans may lose the cheap but limited coverage plans they currently have because the insurance companies that offered them are now required by law to include more care options. Health experts say they'd likely find a plan that's just as cheap or cheaper with better coverage, but here's the catch, Richard, once the marketplace is fully functional.
Well, thank you very much, Dominic. And for more, let's head over to Capitol Hill, where we bring in Congressman Leonard Lance, Republican from New Jersey. Congressman, thank you for a few minutes. I appreciate it.
Thank you for having me, Richard.
Well, you heard today the testimony from the secretary. She apologized. She takes accountability. You also know from leadership of the administration, they say they're going to get this figured out and operational for everybody come November 30th. Is that satisfactory that it didn't roll out the right way, but they're going to right this ship before December?
I hope it's righted as quickly as possible. Let me say that the secretary described the website as a debacle, and I agree with that. And I really wonder why it was not tested and retested before the October 1st rollout. There was no end-to-end testing done except for the last 2 weeks in September, and that complete testing should have been done over the course of the prior several months before October 1st.
What do you want to learn from these hearings? And I ask that because there are some who say very legitimate questions about a rollout that obviously wasn't ready for prime time. But there seems to be some that want to almost relitigate Obamacare all over again. And they don't want this program, even though it's been voted on, it's been legislated, it's been funded, the Supreme Court vetted it, that it's going to roll out, albeit rockily. Are we refighting the last battle, or are people just figuring out what went wrong? What's the point of the hearings both today and before?
The point of the hearing today was an investigation as to what went wrong, because we had testimony in September from administration experts that the rollout, the website, would be fully functional on October 1st. I hope that the website is fully functional as quickly as possible. I do not want the website to fail. let me say, on the fundamental policy of Obamacare, I think the fact that fewer young and healthy Americans are going to go into the system will mean that it will be very difficult for Obamacare to succeed. That is a different question. It is a substantive question. And also, of course, the president has said repeatedly that if you like your health care policy, you can keep it. And that obviously is not true in many cases.
Some legitimate questions. I want you to respond. Your colleague, also from the New Jersey delegation, Democrat Frank Pallone, he was pretty vocal here, and that he thinks there's a lot of different agendas at work in the fact-finding from some of your colleagues. Take a listen. Again, this Congressman Pallone early in the week.
I started out in my opening statement saying there was no legitimacy to this hearing, and the last line of questioning certainly confirms that. HIPAA only applies when there's health information being provided. That's not in play here today. No health information is required in the application process. And why is that? Because pre-existing conditions don't matter. So once again, here we have my Republican colleagues trying to scare everybody.
Will the gentleman yield?
No, I will not yield to this monkey court or whatever this thing is.
This is not a monkey court.
Do whatever you want. I'm not yielding. I am trying to tell you that the problem here,
protecting American citizens,
there are no pre-existing conditions.
Legitimate concern of this committee.
The pre-existing conditions don't matter. HIPAA doesn't apply. There's no health information in the process. You're asked about your address, your date of birth. You're not asked health information. So why are we going down this path? Because you are trying to scare people so they don't apply, and so therefore the legislation gets delayed, or the Affordable Care Act gets defunded, or it's repealed. That's all it is, hoping people won't apply.
I know you heard some of that testimony, and you heard the words Frank Pallone. Does the congressman have a point that while you certainly don't fit under the heading, it sounds like a lot of your colleagues want to see this fail? Obviously, as we saw with the government shutdown, even and the threat of default here over defunding Obamacare, that fight is still being fought right now. And unlike Plan D Medicaid back in 2006 when it had a rocky rollout, not everybody is working on a solution here, but they're still fighting the very premise of the legitimacy of Obamacare.
I disagree with Congressman Pallone. I think the hearing was legitimate. And I think the American people grow weary of the back and forth and all of the disagreement and the shouting. And I do not conduct myself that way. I want the website to be up and running and fully functional as quickly as possible. On the substance of Obamacare, I believe that it is problematic because I do not believe young people are going to sign up in sufficient numbers. But let me say that we have to work in a bipartisan capacity, as I have always attempted to do. We need to reform health care. I would prefer to reform it in a different manner, and I certainly think the hearing was legitimate.
In terms of accountability, where should the buck stop? Should it stop at the desk of the president? Should it stop from the secretary who we heard earlier today? And do you believe somebody should be out of a job here given the rollout that we've seen of the Affordable Care Act?
I have not called for the resignation of the Secretary of Health and Human Services, Kathleen Sebelius. I think she should work to the greatest extent possible to make sure that the website is fully operational as quickly as possible. But I am critical of the President of the United States for saying inaccurately that if you like your health care insurance policy, you will be able to keep it. That is not true with many Americans, and this may affect as many as 800,000 New Jerseyans. We don't know the exact number, but certainly there will be some New Jerseyans who will not be able to keep their health insurance policy, even though they like their health insurance policy.
Congressman Leonard Lance, I appreciate a few minutes. Thank you very much for joining us.
Thank you for having me.
All right, everybody, we jump to a quick break. And in the meantime, though, we ask you to join our conversation here. Go over to Facebook and Twitter and sound off on our question tonight. Who should be held accountable? The very question I just asked the congressman for the bungled Obamacare rollout. We come back after the break. We're going to bring in our panel here to sound off on that very question. Please stay with us.
I am as frustrated and angry as anyone with the flawed launch of healthcare.gov. So let me say directly to these Americans, you deserve better. I apologize. I'm accountable to you for fixing these problems, and I'm committed to earning your confidence back by fixing the site.